There are concerns over COVID-19 vaccine distribution and rollout. Not a new story, of course, here in South Africa. One organisation, though, has taken up the challenge to try and close the gap in the distribution of these doses. The Hope Consortium has launched its first in-country vaccination service. Now, the aim is to enable communities with less medical and logistical capacity to inoculate their people quickly. So how does that help us here in South Africa? Hopefully it can. Well, we're joined by the consortium's Robert Sutton. Mr. Sutton, good morning to you. Thanks for your time. We're going to talk about how Africa and South Africa fits into this picture in a moment, but just help me understand when it comes to the closing of this gap, how does that work exactly?
Great question. First of all, thanks for having me here this morning. If you think about a traditional supply chain, it typically goes from a factory to a retailer or a manufacturing unit or the end user in some cases. Think about the vaccine supply chain that we're managing under the Hope Consortium. We have to manage that from production all the way through to patient. If it doesn't get to the patient, then there's no point us driving this vaccination program. So what we've done under the Hope Consortium is we've looked at the components required to move vaccines from point of production all the way through to the patient, which means that it's not a supply chain task in isolation. We have to collaborate with healthcare providers and specialists up and down that supply chain to make sure that we move it all the way through from the production to the country, into the vaccination site, and then onto the arm of the patient. So we developed both a physical and a digital supply chain to support that.
And when I now speak to you from the southern tip of Africa, you're sitting in a very warm Abu Dhabi, Mr. Sutton. I'm sure you would have taken a look at not just Africa, but South Africa as well. For viewers watching this and watching you and I discuss a possible solution like this, what does a solution for Africa and South Africa look like? What solution would you put in place?
So what it looks like, first of all, is being honest and open about capability in country. So we understand the demand and the need for vaccines and the desire to have vaccines in country. But what we see more often is that countries are asking for more vaccines than they have the infrastructure to manage. So if a country in Africa or a state in Africa, let's say, needs 5 million vaccines, the first thing we would do is go to the country or take advice from the country on their capacity to store at the right temperatures. If that is 500,000, then we would move 5 million to Abu Dhabi. We'd take 500,000, ship them to Africa along with the needles, the syringes, the PPE, the doctors, the nurses, the field hospitals, whatever is required, move them into Africa, and then monitor the offtake of that, so the vaccination program, and then replenish that from here. So we always make sure fresh vaccines are available.
And is our government speaking to an organisation such as yours, whether it be SADC, the collection of countries and governments we have in the southern part of the continent, or South Africa in particular, Mr. Sutton? Are we speaking to you? Should we be?
We're very much open for that engagement. Many of the governments are talking through intermediaries. They're talking direct government to government, or they're working directly with some of the fantastic humanitarian aid organisations which are coordinating the activities. Our role is here to support. As soon as we're aware of the need, then we can rise to that challenge and support.
And I'm interested in as well, not just about the logistical side and the digital aspects of the implementation, Mr. Sutton. The last minute I have with you, a big issue in Africa, not so much in South Africa, but more Africa, is the temperature control systems in place as part of the supply chain. A lot of these vaccines, I forget which one is more temperature sensitive than others, but it's a big issue when it comes to keeping these vaccines at the right temperature, especially in areas where there isn't electricity in hot parts of the continent. What's the solution there, do you think?
So, yeah, it's a huge issue, but there are packaging types on the market now. If you look at SkyCell's technology as one brand there, where we're able to keep a vaccine at a temperature of 2 to 8 for more than 4 or 5 days once it's been preconditioned without any power whatsoever. So the real solution comes into understanding the environment that we're going to deploy into, and then using the right level of technology, packaging technology, smart technology that's available, and not all of that is power dependent, to make sure that we maintain the temperature and the right protocols.
Well, I appreciate you speaking to us all the way from the UAE with some great suggestions for Africa and South Africa, all the help we can get here in South Africa so we can produce our own. Mr. Robert Sutton from Abu Dhabi speaking to us from the Hope Consortium. It's some very, very good ideas, good suggestions as far as vaccines are concerned. Let's look